Hi guys, welcome back to my channel. Today I wanted to share a little bit about my breastfeeding journey as well as the products that I've been using recently that have super helped me during that time. I had my daughter on the 7th of August. She's about 2 months now, and we've really had some ups and downs and some struggles when it comes to breastfeeding. Initially, my thoughts were to breastfeed, and that was, what we started doing. We brought her home. We started to breastfeed. Initially, it was fine, and I started to experience pain little by little as we went, every feeding. And it's something that I kind of put off. It's something that I thought I would be fine with, something that might go away. There were times when I experienced it more than others, so I kind of just ignored it. And unfortunately, on the second day of having her home, I started to really experience pain. I had super dry, super cracked nipples. There was blood, and I had a lot of scabbing as well. So it was a little bit traumatic for me of an experience. I was to the point of calling the doctor and asking if I can have an earlier appointment and crying over the phone because I was so distressed and I was so emotionally just drained from the experience. And it was hard for me because people talk about breastfeeding as something that's beautiful, something that bonds you and your child together. And it was so hard for me because I did not look forward to feedings, unfortunately. And I think that's probably something that's difficult for mothers to really say, I don't know. In a way, I felt like I would be criticized. I felt like I would be judged. To say, this isn't what I want to do. This isn't what I imagine motherhood to be. And it was hard to be in that headspace. I went to her appointment and we talked to the doctor, and they confirmed, obviously, babies do lose weight after they're born in the first week. But they did confirm, they felt that the amount of weight that she had lost probably did have to do with not eating enough. So at that point, I had to think on my toes and figure out what am I gonna do, because I'm her food source, but I couldn't emotionally or physically attach her to me anymore. Luckily, I did have a breast pump at home, and it's not something that I thought I would use, but I started to use that, and it was a lifesaver for us. I mean, I think it definitely saved our, growing relationship that we had. Not only that, but it did make it possible for me to at times get a little bit more sleep or have time to do other things that I needed to do. I still did feel deep down that I wanted to breastfeed. It was hard, to adjust and to realize that might not ever happen. Periodically, I would try to put her on my breast, and she hated it. There was times when she would go a minute or two, and it still hurt and was painful for me, but at that point, I no longer had the scabs. It had been a while since we had tried it, so I felt a little bit better, a little bit more confident. She was not having it. She hated it. She cried. She was fussy, and she kicked at all costs. Did not want to be attached to me. So I kind of just took it as that's that. It's not going to happen for me, and it was a hard pill to swallow. However, there was times that I would go a week without trying to latch her on, but as of 2 weeks ago, I actually was able to get her on, and she seemed to enjoy it. And little by little, I would give her a couple bottles here and there and try to breastfeed. It was still painful, but it definitely wasn't the pain level that I used to have. And the reason being, I think also that I did so much better this time was because of the products that I've used. So that's what I want to share with you guys, because I think that's going to be it's going to play a big factor in how you feel and what you're able to withstand pain level wise. There's times when she latches on still, and it does hurt, or they feel like they're starting to get cracked. And I've started to use these products and I see the difference. So the first one that I want to share with you guys is this nipple cream. I have 2 different sizes. So this is a bigger size. This is a smaller one. And I have this smaller one, comes in a pack of 3. So I like this one because it's more like a travel size. You can stick it in your purse if you carry a purse, but I personally, I have this in my diaper bag. I have one in her diaper caddy in our baby room. And then if I need to, I've had this before too in our living room. Just sometimes I breastfeed there, and you know, after breastfeeding or before breastfeeding, like I'll put this on. And then this one I like to keep in my side table, so my bedside table, because it is bigger and I spend more of my time there. But I think it's pretty important to have the different sizes, to be honest, because you're not always going to remember to throw this in your bag on your way out. It's just good to have it in there, and sometimes you have so many things that you don't want to have a bigger one. It'll kind of get in the way. But this one is so this brand, Lansinoh, is really great. They have so many great products for mothers. In particular, this nipple cream is 100% natural, so you can actually put it on and not have to wipe it off or clean it off before you breastfeed, which I absolutely love. You know, there's times when she eats and she decides she's done. I put it on, and then 5-10 minutes later she wants to eat again, and you know, so it's nice that I can just latch her on. But it does feel, honestly, it's kind of like it's sort of cooling, and it feels like a barrier, so it kind of seals up those cracks that you might have on your nipple. If you're gonna shower and your nipples are hurting, you can throw this on as well, and it acts like a barrier. But this is really great, and this in combination actually with this here, these are they're cooling gel pads, the same brand. This one I just actually bought it to replace the ones that I had used, but these are good for up to 72 hours. When you take them out, they're like this. They're kind of like those little those little gel things you put on your breast if you're not gonna wear a bra. So this is what it looks like. When you're not using it, you can just place it back on here and then take it off when you're ready to reuse it. But like I said, they're good for 72 hours, and they're a cooling gel. So when you place it on your skin, you feel that cooling effect. It feels really nice and fresh, and it definitely helps. There's times when I breastfeed and my nipples are hurting and they're just like dry. So rubbing against clothing, rubbing against your bra, even putting my bra on sometimes hurts. So having these make a big difference because they're that barrier that's gonna help you. But after you have them on, I want to say like maybe 10 minutes, you're probably going to adjust to your body temperature, but you can always take them off, wait a couple minutes and put them back on, and they'll give that cooling effect. Another thing that I tried recently in the last week was this here. So this is a nipple shield, and it's the same brand as well. Let me see if we get a little bit closer. So it comes with a little case, and it comes with a set of 2. So you can use one on each breast. I only took one out, and I use this one if I use this one for both. So this is what it looks like. It's like clear, and it has little holes inside, just like a bottle would. I thought it might not attach so well to my skin, but it actually really does. It holds on pretty well, and you could just suck on your nipple just as normal. I don't think this will necessarily take your pain level away, but it'll help with like the cracking, and it'll help with the scabbing. So I do think this is a pretty good thing to have, especially at the beginning if you're, unsure. I mean, I wish that I would have just put this stuff on and had this stuff when I first started breastfeeding, because I may not have had the issues that I did when I did. But, if you're a mom who's concerned about breastfeeding or who has had trouble with breastfeeding, just there is hope. It is possible, that you might be able to breastfeed. I had my mom and my aunts telling me, well, you've given her a pacifier, you're giving her her bottles, like she's not gonna want to latch onto you. You have nurses telling you the same thing and doctors telling you the same thing, which I understand. They get used to something familiar and they don't want something else. But like I said, in my case, I gradually, every maybe 5 days tried to latch her on. And then after, we tried a little bit longer, I was kind of like, well, this is what you get and you're gonna eat it if you're hungry. And she ate that one time, I don't know, I could tell she didn't really want it, but she ate from my nipple. And now I will be 100% honest with you guys, she doesn't really care for the bottle. She prefers me instead, and it is such a beautiful experience. But if you're frustrated, if you're unsure, like just know that it is a possibility, and you might struggle and you might have to wait, a period of time. Like I said, she's 2 months old now, and this is, only been going on for 2 weeks. So for the first month and a half of her life, is something that we kind of dealt with and worked on. And at this point, I feel a lot more confident and more comfortable. There are times when it does hurt, but these products have 100% changed the pain level and have made it possible, I think, for me to breastfeed. A lot of people say, well, if it's hurting, then they're not latched on correctly. And I don't necessarily believe that. I think to some degree, you're gonna have pain, and it's, at least at this point, it is tolerable when I do have it. But don't be discouraged, don't be scared. If it's something that you want to do and something that you've always thought would be something that you'd want to do with your baby, I definitely encourage you to try it, even if it is here and there, if you have issues with it. But you can also always talk to your doctor, and they have lactation nurses, they have a lactation specialist in the hospital too when you're there. And they have lactation nurses when you go to your doctor to see your baby's pediatrician. You can talk to them, you can show them. At first you might think, well, that's kind of embarrassing, but once you have your baby, I mean, these nurses see so much of your body that you don't really care. So, that's the least of your worries is going to be pulling your shirt up to put your baby on a breast and having somebody take a look and see if it's the correct way to do it. But you guys will learn each other's bodies, and just be patient with your baby, be patient with yourself, and love yourself, and know that you're doing a good job. And it's, if it doesn't happen right away, there's still a chance for you. That's really what I wanted to share with you guys too, because it was an emotional journey for me. It was hard, but I'll leave you guys with that. I'm gonna go ahead and link all this stuff in the comments, and I'm gonna leave it in the description. Thank you guys for watching, and I hope that you enjoyed this video. If you felt like there was something that was meaningful and that was helpful to you guys, leave me a comment or like my video, let me know, and I'll see you guys next time.